Hi everyone, Dr. Nemechek here. If you followed some of my videos, you know we've got this problem with COVID, causing long COVID, and how, at least in a proportion of those patients, they respond really well to some glutamine supplementation that helps fix the gut. But one of the things, how do you know if people have long COVID? How do you know if people have COVID? Because hardly anybody's testing. And quite honestly, sometimes it can take 2, 3, or 4 days of testing in a row on the swab test to get a positive. Okay? Well, an important thing is, and that's very different, is prior to COVID, it was very unusual as a doctor. You would have somebody say, oh, Bobby got sick and the whole family got sick. That didn't happen very much. That's not real common. It's usually Bobby got sick, one other kid got sick, but nobody else in the family got sick, and or it's just Bobby got sick. I mean, that's typically the vast majority of all the cases. And what you see a lot now is parents will be talking to me and I'll ask, you think anybody get sick this summer? Oh yeah, Bobby got sick. It's a how's the rest of the family? Oh, we were all sick. I hear that all the time. And I want you to understand it has to do with how infectious COVID is, or SARS-CoV-2. All right? Now, this little chart I have here, and I'll put the reference in the discussion section, or description section, is looking at the infectivity of these different infections. And so here they're looking at classroom, down below it's about barracks, and they're basically the same. But here is the flu, this is old COVID, different part of the world. Coxsackie is another one. Being treated for tuberculosis, which is not common. Here's MERS with Middle East Respiratory Syndrome, pretty low infectivity. Rhinovirus, this is the vast majority of all the colds that kids are going to come home with. And then over here we get adenovirus. This can cause like a common cold thing, but much less frequent than rhinovirus, okay? Now here's COVID, or SARS-CoV-2, untreated tuberculosis, and then measles, all right? Basically, of common things that affect, infect people in the United States, COVID that we're dealing with right now is the second most contagious thing, all right? Because we don't have untreated TB. That's not a common thing here. And so what this tells us is here's the risk of infecting other people, all right? And here's up 10%. So you can see the very common thing, one person, what this means is one person might infect one other person, okay? Pretty low, and that's kind of what happens in the classroom. Here's SARS-CoV-2. And what these are, this is very low to no ventilation, medium, and then high ventilation. Or excuse me, I got it backwards. This is high ventilation, medium, and almost no ventilation. And so if you're in a crappy ventilated place, like a grocery store, a bar, maybe even a lot of classrooms with outdated systems, okay? Very high you have a chance of 10 times more infectious. All right, and then that kid comes home. He's 10 times more infectious than the typical thing when he's around the other family members. All right, now here's really bad, measles. So if you ever hear news reports that we had a measles outbreak in Florida, and it's like a big deal, it's because it is so contagious. Okay, they're worrying about it spreading very quickly. We have these growing numbers of people that are not measles vaccinated. So this is what you're seeing when you get that story. So again, it's about trying to keep everybody healthy. Kids, there's a lot of long COVID in children. It might be they just got ADD. It's not just ADD. It's from long COVID that might resolve if you give them glutamine. They could be depressed. It could cause PMS. It could cause POTS. It could cause all sorts of stuff. And you have to kind of be suspicious. And so my perspective, if I had children today, would be if suddenly all of us were sick, in the household. Now, I would be testing, but say that's not positive. Everybody kind of gets sick in the house, maybe kind of mild. Let's not bother. There's a high degree of suspicion they're going to have COVID. And we think 20-30% of people who have any symptoms from COVID are going to have symptoms for a minimum of a year, maybe 2, from high inflammatory condition, of which I believe a major part of it is this unique damage in the gut that requires glutamine therapy. And again, you can look at the other videos I have on this, okay? But this represents the infectivity. It's super infectious. So you gotta gosh, Billy's not doing too well. What's going on at school this fall? He's just not performing well. If you think back, you can think back well, yeah, he was sick in July. As a matter of fact, we all were sick in July. He might have had COVID, and you might be able to turn this around just with glutamine. Okay? Now, the dose I use for kids is 0.3 grams per kilogram of weight, and that's a total daily dose, and you split that in half of it in the morning, half of it at night in cool or cold water or juice, and that usually will take care of things. The inflammation they've shown will start dropping within 5 days of starting that glutamine. The gut's probably healed, and the inflammation down to a very low level within 4 to 6 weeks. So you could possibly just flip this whole thing around on your own, okay? Your primary care doc's not going to know anything about this, okay? So that's about it. I hope it's helpful for everybody. Other than that, remember to subscribe. If you want glutamine, I suggest using the Now Sports version. If you're looking for fish oil or olive oil, always go to nemechekprotocol.com. Everybody take care.